When you're diagnosed with type 2 diabetes, you're often told the same thing. It's a chronic condition you'll have for life. You're handed a prescription, maybe two. You're advised to watch your carbs, lose some weight, and come back in 3 months. But what you're almost never told is this: it's possible to reverse it, not just manage it, but reverse it. And that raises the question, why? Why don't doctors talk about reversing diabetes? At Ditch Diabetes, all naturally, we get this question all the time. People feel stuck, frustrated, and betrayed by a system that told them they'd be sick forever. So let's talk about it honestly, because the silence isn't accidental. And once you understand why it happens, you'll see the power was never out of your hands to begin with. The truth is, doctors aren't trained to reverse disease. They're trained to diagnose and manage it. In medical school, the vast majority of training focuses on pharmaceuticals and protocols. Lifestyle medicine, nutrition, stress management, those topics barely make it into the curriculum. That's not a knock on your doctor, it's just the way the system is built. Doctors go through years of education, but almost none of it prepares them to guide someone through holistic healing. What's more, most physicians genuinely believe that type 2 diabetes is progressive and irreversible. It's what they've been taught, so they approach it the only way they know how: medications, monitoring, and minimizing risk. Even if they want to help you go deeper, they're operating under time pressure, insurance codes, and clinical guidelines that leave little room for anything outside the mainstream. The average appointment is just 15 minutes. That's barely enough time to adjust your prescription, let alone teach you how insulin resistance works or how the body can restore itself with the right support. And even if your doctor wanted to help you reverse your condition naturally, the system isn't built to allow it. Insurance companies don't reimburse doctors for coaching you through lifestyle change. They pay for medications, labs, procedures, not for root cause reversal. So, unless your doctor is also trained in functional or integrative medicine and has chosen to work outside of insurance, the reality is they probably don't have the time, tools, or resources to support you on that level. Let's not forget the pharmaceutical industry. Type 2 diabetes is a multi-billion-dollar business. The longer you stay sick, the longer you stay a customer. Insulin, metformin, blood pressure meds, cholesterol meds, newer weight loss injections, all of these are recurring revenue streams. None of them are cures. They are designed to manage your numbers, not heal your body. That doesn't mean your doctor has bad intentions, but the system they work in has strong financial incentives to keep treatment going, not to bring it to a close. And yet, here's what the science and lived experience shows. Type 2 diabetes can be reversed, not through magic, not through guesswork, but through a systematic, holistic approach that addresses the actual root cause: insulin resistance. This condition doesn't happen overnight. It builds slowly as the body becomes less responsive to insulin due to poor nutrition, chronic stress, poor sleep, sedentary living, and excess belly fat. But just as it developed over time, it can be undone over time with commitment, guidance, and the right framework. At Ditch Diabetes, all naturally, we see this happen every day. Women in their 40s, 50s, even 60s who were told they'd be on meds for life are now reducing their medication, dropping weight, clearing brain fog, and reclaiming their energy, naturally. And yet, so many people are never told this is possible. They're caught in a loop of finger pricks and pharmacy visits, with no map to real healing. You might be wondering, why haven't more doctors spoken up? Some have, but the medical system is conservative by design. If a doctor tells a patient they can reverse their diabetes and the patient stops taking their meds without following a plan, it could lead to serious complications and even lawsuits. So many doctors stay quiet. They don't want to give what they see as false hope. But what you really need is real hope, grounded in science, supported by coaching, and led by people who understand how the body actually heals. There's another problem: language. The term reversal isn't used consistently in clinical settings. Instead, they all say remission, which technically means your blood sugar levels return to normal for at least several months without medication. But most people never hear that word either, so they assume once they're diabetic, they always will be. That's simply not true. But if no one tells you otherwise, how would you know? Even when you search for answers, you'll find confusing, conflicting advice. Low carb versus plant-based. Intermittent fasting versus 6 small meals, keto versus vegan. It's a mess. And when you're already tired, overwhelmed, and scared of complications, the last thing you need is more confusion. That's why structured, holistic programs with support and clarity make such a difference. They take away the guesswork and replace it with education, accountability, and strategy. So here's what you need to know. You are not destined to stay sick. Type 2 diabetes is not your identity. It is a condition, and conditions can change. Your body has incredible capacity to heal. When you lower the foods that spike insulin, reduce inflammation, move your body gently but consistently, manage your stress, and sleep deeply, everything begins to shift. Your cells begin to listen to insulin again. Your pancreas gets relief. Your liver starts burning fat. Your blood sugar drops naturally, without drugs. But this doesn't happen on accident. It happens with intentional change, with the right guidance, with a plan, and yes, with some patience. This is not about perfection. It's about consistent progress. It's not about starving yourself or cutting out everything you love. It's about eating real food, nourishing your body, and rebuilding trust with yourself. That's what we do here at Ditch Diabetes, all naturally. We help you take back control. If you're tired of Band-Aid solutions and ready for real healing, if you've tried diets that didn't stick or meds that left you feeling worse, if you're ready to wake up with energy, lose the weight that's clinging to your middle, and step into the confident, vibrant version of yourself you know is still there, you are in the right place. Because the truth is, you don't need another prescription. You need a roadmap. You need education. You need accountability. You need someone who's walked this path and can guide you forward. And you need to know, it's not too late. You can change your story. You can reverse your diagnosis. You can feel like you again. So don't wait for your doctor to tell you it's possible. Take the first step yourself. Subscribe to this channel, Ditch Diabetes. All naturally, for weekly videos on reversing type 2 diabetes naturally, reducing medications safely, restoring your energy, and finally losing the weight that won't budge. Every week, we break down the science, simplify the steps, and show you how thousands of women are reversing their diabetes without diets, drugs, or drastic restrictions. You don't have to do this alone. Your healing starts here. Subscribe now, and let's ditch diabetes naturally.